Hi, good morning, everyone. I must say it's a good evening for me. I am sitting in Canada right now, and this session is live from Toronto. Uh, so we are live on 110th CMAAO session. This is the international weekly meeting where all the national medical associations do meet up, and we share a common platform to understand what's going on in the world. And I think I have a small update to give. I have done an extensive travel in the last 4 nights. I flew from Delhi. I traveled to Abu Dhabi. I went to US. I stayed for a night there. Then I went to Canada. So a lot of COVID restrictions are still on. In US, you still need a mandatory COVID testing in last 24 hours. You don't really need to wear mask there. The mask restrictions are off, but COVID, protocol needs to be followed. You need to maintain the distancing. They do tell you to wear mask, but it's not very mandatory. what what I noticed for Canada, you don't need a COVID testing to enter the Canada, but it is very stringent that you have to wear mask even during the flight. They will not let you take off. If you're sitting in the flight, if it's a 2 hours flight, you have to wear mask for next 2 hours. You cannot remove the mask. The only time you can remove the mask is when they serve food. And if it's a shorter flight, you don't even get food, so you can't even remove masks. And if you remove mask, the air hostess will come, the cabin crew members will come, and they will ask you to wear the mask immediately. But when I go around the city, I don't see people wearing mask. So it's very confusing what's going on. But I think what they're trying to say is that uh, COVID is still there. You need to follow the mandatory COVID protocols, and a lot of countries are trying to follow. So there is an app which Canada has made. It's a Arrive Canada app. You need to upload all your vaccination certificates. You need to upload all your testing reports, everything, and they will give you a barcode. So they have basically removed the interface of a human at the immigration. They have made sure that people upload a lot of information during the web check-in and during the arrival with the machines. So it's very good way of removing the interface and keeping the distance of social distancing. What it also helps is that you, even if there is no COVID and the things moves on smoothly, it still convince you that you're not getting infected with, like, whoever is touching the machine, or the long queues and everything. Even I saw long queues at the immigration counter, but people were wearing masks there. So that's a short update which I wanted to give you. In last 4 days I've traveled, and I would like, we have Singapore here, we have Pakistan here, and we have other countries. South Africa is here. I wanted to understand what's going on in terms of travel protocol there, and what's going on with the country in COVID. We don't have a speaker today because I just called it off at the last moment. We will have that speaker of Ishik Khosla coming up in a couple of weeks' time. So, Dr. Chong, would you like to take it forward?
Yes, thanks, Arab. Nice to hear what's happening over in Toronto. And in Singapore, everything is sort of like quite low key at the moment. 3,000 plus cases in the last 24 hours. It seems in our city now, it seems that life is going back to normal. The traffic is quite horrendous. The foreigners are back. A lot of my foreign patients are back here in Singapore from the surrounding region. So it seems like life is really, really going back to normality. I was at the airport to pick up my son the other night, and the airport, Changi Airport, was quite packed, was quite crowded. I think the restrictions on travel to Singapore are very minimal now. Masking is just indoors. Any indoor venue you have to wear a mask. Anything outdoor, you don't have to, right? It's not necessary. But otherwise, and all the restrictions on big events like churches, mosques, temples, weddings, even big events like conferences have all started to ease off, meaning that they are allowed to hold these big conferences and so on. And so I think really life is going back to normality here in Singapore. And the healthcare system, but the healthcare system is overloaded in Singapore because I think there's a lot of pent-up demand in the last 2 years. We had a lot of patients cooking, they haven't been seeing their doctors, and so we've got quite a bit of pent-up demand in public sector, and it's spilled over to the private sector as well. So the other night I had a patient, I was trying to get her into hospital, and in the private hospital here, and there were 30 patients ahead of her in the queue to get a bed. So yeah, so it's but the spillage, I mean, the spillover is not because of COVID. It's really because of all the pent-up demand in the last 2 years. And of course, all the stuff that wasn't picked up or the stuff that was cooking has now come back to roost. So that's from Singapore. Thank you.
So I have a couple of questions here. So when you say, things have piled up and a lot of people are coming to the hospitals, so what is there any specific diseases where people are coming? Like it could be an ENT, it could be a heart patients, or it could be what kind of diseases are more often seen? And is it somewhere related to long COVID also? Like, people may have, issues coming up with the long COVID, which they may not have it.
I think we see quite a lot of the spillover are actually surgeries that have been kind of pushed off for a while, elective surgeries, then for example, people who, for example, my cardiologist, he's got quite a large number of patients who who haven't come to see him for 2 years, and they came, and then to their horror, CT coronary angiogram shows blockages, so we need to do stenting, and I mean, so that kind of feel and look. In Singapore also, we now have a dengue outbreak, 6,000 over cases in the last 2 months. So we had a big dengue outbreak. So that's also been troublesome for us and clogging up the hospital beds. So yeah, it's coming from everywhere. Yeah.
In fact, Dr. Chong, you pointed out one very important thing which I also noticed. Things are coming back to normal, but I think it's over normal because a lot of people who have not even traveled, they're all out for traveling. Tickets are very expensive. What I also noticed is that I have never seen so many people in front of me in security ever in my life, what I see right now. So how is that gonna be an issue when people are traveling and COVID? You can't follow COVID. Like I was in New York airport and I was boarding a flight to Vancouver. I probably would have 300 people in front of me doing a security check. Can you imagine? I am saying less. I would say there were more than 300 people. There were like 10 queues, and every queue has about 30-40 people. There is no way you can maintain
normality. Back to normality. Long queues at airports.
There is no way you can follow the protocol.
Yeah, I've just checked my website, and we've taken away the pre-departure test for Singapore. So when you come to Singapore, if you're vaccinated, no need to do anything.
Yeah.
No pre-departure test.
Yeah, but you need to be vaccinated.
Yes, you need to, and it has to be recognized, the WHO vaccines.
Okay. Yeah. I in fact, I think Covaxin, Bharat Biotech is also accepted, which was actually an issue before because a lot of people said COVID Shield is what is accepted, and if you want to travel internationally, Bharat Biotech Covaxin is not, but it is accepted.
Shall we get Dr. Pillai to update us on what's happening in India?
Yeah. India, of course, the number has considerably come down, say 3,000, that sort of range. And now every activity is in full swing back to almost normalcy. And internal air travel definitely has picked up And in fact, as you rightly pointed out, even in India, there is so much of crowding in airport. But then using a mask while traveling by air has to be insisted on, because some of the studies done show that during flight, if one person has got infection, then at least 20% of the people at 2 or 3 rows in front and back, they are likely to get the infection. So air travel, in spite of high-speed airflow is there, air travel does carry a greater risk than other internal activities. So that's why I think the mask wearing is being insisted upon. Then, of course, another good news about India is that mRNA vaccine has been developed by one of our research units, and animal experimentation has shown that the antigen buildup is very good, and its activity against ACE2 receptors has been good, so much so even getting an infection now the vaccine is supposed to protect from severe infection and mortality, but it does not completely prevent infection as such. But the vaccine that has been developed shows that even in that area the potential is very high, that contracting an infection itself to some extent is reduced. And now the second stage will be for some of these vaccine manufacturing firms to take up this and develop the vaccine at the commercial level and doing human experimentation. But the time gap required to put it into the market definitely will be very less, maybe 6 months or so. Then another phenomenon that we watch is it could be long COVID or whatever. Maybe in many patients, infection itself goes unnoticed, but they come with thromboembolic episodes, EVTs and pulmonary embolism. Even there have been instances where there has been a large clot in the heart itself. So embolic episodes as part of the long COVID phenomenon or whatever, the incidents are very high, particularly among the youngsters, more than the older generation. Among the youngsters, thromboembolic phenomenon definitely is very high, and that's also a matter of concern. So that's where we stand in India.
In fact, I think in India, the recovery rate is almost like more than 98%, if I'm not wrong.
Yeah.
So I think that's one of the good news. And since the recovery rate is very high and the active case only stands less than 0.5%, 0.05%, I think that is the reason why there is no fear right now and people are walking without the mask. It's been treated as a normal flu, I believe, in India now. And at least the rest of the world as well. Okay. Can we have an update from Dr. Qazi from Pakistan?
Yes, Dr. Qazi.
Oh, yes. Thank you very much, Sarab. Thank you, John. Well, I updated nicely about the India. It's a very good idea that we are today talking about the travel updates. I can share my experience. Last month, I traveled to Europe, and in April, and it was a 15 days visit to Europe, and there was no pre-boarding testing requirement. But all we needed was just the COVID documents we had to upload on the through the net, and a QR document was generated, and all the vaccination data was there. And while traveling by plane, it was mandatory to wear masks, and there were lots of travelers. And I landed up at Barcelona, and it was very smooth, check-in, and the immigration was perfect. And then while we were in Barcelona for 5 days, lots of tourists were there, and hardly I saw very few people wearing masks while we were, tourist spots in the open. But they definitely asked for the mask wearing in the restaurants and places, in indoor places. And then from Barcelona, I traveled to France, Lyon, and I traveled by bus. And the during boarding on the bus, they asked for the COVID, document that was generated well before our, arrival there. And what all they needed was the ID, definitely the passport, and the COVID document that was shown to them. And while on the bus, we were asked to wear masks while traveling. And after 2 hours, every 2 hours, they had a stop over, and where we were allowed to, take off our mask while in the open. And then I stayed there for 3 days there. And from there, I went to Geneva, the same situation. No pre-testing, nothing was required, just that document was good enough. And from there, I went to Milan, Italy, and from there to Rome. And in Rome also, the similar situation, no difficulty while traveling, and no testing required. And in Rome also, there were lots of tourists. I think, as Sir has pointed out, that it's the super normal sort of thing after the COVID pandemic. The people are, getting out of their homes, traveling to these tourist places. And even when we took a guided tour as well, and the guide was also telling us that while we were in the van or the bus, we were supposed to wear masks, and on the spots in the open, they allowed us to take off our masks, and everything was fair and good enough. And we enjoyed that Rome visit also to all those historical places, and lots of tourists. I mean, it was overcrowded there, and situation seemed very normal there. And then when I came back, all I needed was a fast track to enter Pakistan. And that is also a sort of document. You have to upload your flight number and everything, and all your vaccination, details online. And with that fast track and tracking ID, you are allowed to board on the plane. In fact, I was traveling through Qatar Airways, and the Qatar Airways, they asked for that fast track to travel back to Pakistan. And it was, when it was shown, they just gave us the boarding pass. So, when we arrived at Karachi airport, they just asked for the tracking ID of that fast track. So I think the documentation are getting more important, and only the fully vaccinated with the boosters completed, they allow you for all these travels. And what we had here in Pakistan, we had Sinopharm vaccines, initially 2 doses, and then I had Pfizer BioNTech vaccine boosters, and those vaccines were quite acceptable at all the entry points and exits. So this is how the traveling is coming back to normal, and it's a good idea by Saurabh that today we can make the session of travel update post-pandemic, and I think that was a good, sharing, and the Europe is quite open, and it was my personal experience 3 weeks back. And last week I was on a Zoom meeting with the Beijing Chinese Medical Association, and they still have their travel restrictions, and there's not more traveling into China or out of China. So that's what I heard through the Chinese Medical Association, that they have travel restrictions and they're very strict about the COVID, testing. I haven't been to there, but it was a Zoom meeting, and that's what we wanted to know, what's the situation there in China. So this is all about my personal experience of travel a few weeks back. And thank you, Saurabh. However, the condition in Pakistan seems pretty good, and there were no deaths during the last 24 hours. Testing is still going on. Usually, those who wanted to travel, and there are some places like Saurabh said, traveling to US, you need to have 24 hours prior testing, and the vaccination program is pretty good. Life is back to normal. In fact, we have a lot of political activities. You must have seen on television that there has been, lots of big rallies and all that. It's all overcrowded, and you hardly see wearing masks during those, rallies and all that. So that's what about Pakistan at the moment. Thank you, Saurabh.
Well, I think we covered US and Europe both in this session, so we know what's going on in Europe and US now. And what I'm also trying to understand whether, wearing mask in airlines is that an airlines rule, or is that a COVID rule by WHO or someone else that you have to still wear mask, because the rules in airlines is very different from the country rule or city rule, at least
Exactly.
the foundation.
Exactly. It's the airline rules, I think, because some airlines are very strict, like Qatar Airways, they were very strict, and they always wanted you to wear, except the time when they were serving, meals or that. Otherwise, the cabin crew will come to you and will ask to wear mask.
Yeah. Okay. So let's move on with this. Can we have an update from Taiwan? Hi, are you there from Taiwan Medical Association? Okay.
Okay. We are actually in the stage of transitional. I mean, between the tight control and free open for the country now. Yesterday we had more than 60,000 new cases confirmed. About 40, somewhere a little bit, about 40 cases passed away due to Omicron. So it's a little bit chaotic. I mean, our life is so-called rather normal, but a little bit chaotic because people like to have more screening, test kits to be available. But we are still unsure of the screening test kit. It probably another 2 weeks before we get a so-called food supply for the social, for the need of the whole community. So the medical center, like my medical center, Taipei Veteran General Hospital, we have somewhere about 27, 28 hungry beds. Now we have to make at least about 30% of the beds available for the COVID-19 infected cases. We have to, that means we have to cut down the regular admission, regular surgery used to be. And in outpatient care, actually, I mean, patient automatically reduce their visit to the medical center now. For example, I used to have 50 patients per visit, but now I have somewhere around 25. So it's okay. I mean, in general, for the country, it's okay. But I mean, for the past 2.5 years, because our pandemic control here, it seems to be rather well. And so now it's getting a little bit more difficult. I mean, sentimentally. My daughters has a family member, including domestic helper. They have 7 people. Everyone got infected in the past 2 weeks, but they are recovering about more than 90% right now. So it seems to be okay. That is pretty much what I have for you.
Thank you so much. And I can see your niece, I think your daughter's behind you.
That's granddaughter. She got infected. She got infected which day? Friday, about 9 days ago. But she's okay.
Okay, that's great.
Yeah.
So I also see you wearing mask at home. So is it something which has been
well? No, because I'm coming to see them. So I'm supposed to have the mask be on. But the mask is still required in the public. Okay, it's still required in the public. And now, like in medical center, we are required to have N95. When we making wrong in the outpatient care, we are required to have N95 now.
Okay, great. So can we have South Africa, Dr. Angelique and Dr. Akhtar Hussain?
Yeah, good morning, Saurabh and everybody. South Africa was doing very well, but last two weeks, things have been changed. And last few days, it's gone up to 10,000. Day before yesterday, it was 8,300, and death was 114 cases. And our recovery rate is 95.4. And active cases yesterday was 76,274. The issue of vaccination is going slow, and the government trying for booster dose and above 12 years, but is still struggling on the vaccination. It's about 35.5 million total single doses of vaccination so far done. Borders are open. You just need a vaccine certificate. There are no vaccine COVID-19 test result they need anymore. Inside, they are still practicing wearing mask. Outside, nobody is wearing mask. Crowded area, nobody is wearing mask. And there was a controversial school children must wear mask or non-wear mask. But now they started to wear the mask. So hospital admission, public sector numbers are still very low. Private sector, there are admission, but those are not serious cases. In those who are vaccinated, there are very few admission, but mostly senior guy with the comorbidity admitted without having COVID vaccine done. And still those who haven't taken the COVID vaccine, they are the one queuing up in the hospital. Thank you, Saurabh.
Thank you, Dr. Angelique.
Good morning, and thank you for hosting these type of series. And I know it's been for more than 2 years, and thank you again for that. So what I am seeing first of all in the practice again, and I think Prof. Mahdi mentioned it also last week, is that even if you had Omicron B1, there are people whose immune systems, antibodies wanes down, and we are also seeing that same people getting BA4. So this brings a question to my mind regarding herd immunity, whether that with the new subvariants escaping immune systems, whether we can still rely on herd immunity. That's the one thing. Then South Africa published a week and a half ago their new temporary regulations, healthcare regulations, and there was 3 regulations. One, as Akars was saying, regarding the wearing of masks indoors. The second one was the gathering of people. And then a third regulation that makes absolutely no sense. And knowing Africa and South Africa, this is going to bite us. So that regulation says that if you come into the country, you need a PCR 72 hours old. If you don't have a PCR, and this is where the stupidity of this regulation comes in, you will be tested at the airport or at the customs and with rapid testing. If the results are positive and you don't have symptoms, you're allowed to go through. If it's positive and you are having symptoms, then you need to isolate. Now, who in their right mind will say that they have symptoms if they know they are testing positive? So, so there are no guidelines on who will decide if you having a positive test, whether you are sick or not, whether you are symptomatic or not. And we all know it's very difficult. You can examine a patient and you've got a high index that they are positive, but clinically you will not be able to make a good case that yes, indeed it is possible. So you go a lot on the symptoms that the patient is giving you. So if I'm a person coming into South Africa, I know I've got COVID underlying, I will not do my PCR. And when I get into the customs, I will just vehemently deny that I am having symptoms. So I think sometimes governments need to look at what type of regulations they're bringing in and how practical that regulations are, because this is a regulation that makes no sense. I also, what I do agree with our government is the wear of masks indoor. And I think I haven't traveled. No, let's rephrase this. I haven't traveled recently with on flights inside the country, so I'm not sure whether some of these airliners want you to wear masks. I know we need to learn how to live with this virus going forward, but we also need to alert people that even airports might become and flights might become super spreading events, and do not be giving the false security that I have been vaccinated, therefore I will not get COVID. Your vaccination is only to prevent you from severe disease. However, vaccines not preventing you from mild disease. And yes, even if you had the current Omicron, you can still get one of the subvariants, even if you have been vaccinated. We have seen all of this in the practice. So I think it's important to get this message out there. Thanks.
I think that's a very good update. And I also strongly believe that if there is any major infection which comes it will through our travel, because right now the travel is way too difficult and there's a way too stressed which is happening. So I was reading one of the articles here, and it says that Toronto airport had about 30,000 per day international passengers, which has now increased to 45,000 per day, and it is expected to grow up more. And the situation is where they're facing a very lengthy wait time, and it gets worsen and worsen. The kind of screening which is happening, the shortage of staff which is happening, the demand has gone up. So I don't know how these countries and the travelers will save themselves with these infections, but this is something which is a cause of concern today. Unless, because a regular infection can also be spread through these, close people traveling in the security lines and in the immigration lines. So we have Dr. Jamal Chaudhary. Dr. Jamal, can you please give an update on what's going on from Bangladesh?
Thank you so much. So actually, I am on the journey, so I could not join early. So anyhow, at least I could join. That's good seeing you here. And in Bangladesh, actually, everything is normal, and we have only near about 20 to 30 cases per day, something like that. No death. Actually, in one district yesterday, I have seen the infectivity rate has gone up. That is, it's a border area, Sylhet, and 20% infection rate is there, but number is less. So only 8 cases are there. So this is the situation in Bangladesh. So nothing. We are almost more than 80% are vaccinated. So this is a good thing actually here. That's all. Thank you.
Dr. Jamal, do you have any update on travel in and out from Bangladesh?
Travel. Yeah, travel. Only thing is that you have to wear the vaccination card. That's okay. To second dose, and after second dose, only 14 days have to be elapsed. Only you need the gap of 14 days after the last vaccination. That is the thing. Okay.
Okay. Thank you
Hello.
so much, Dr. Jamal. I think you're traveling right now. You're on the wheels, so your network is also an issue. But yeah, we could hear you. So over to Dr. Chong.
Thank you. Okay.
Dr. Chong, you are muted.
Yeah, I think thank you everyone, and it always a pleasure meeting everybody here on a Saturday to listen to what everyone has to say about the situation back home or abroad. So I think without much further ado, I thank everybody for joining us this Saturday.
Chong, I wanted to make an announcement before you
yes.
Before you close this meeting. As we all know, this is May, and the person who started this meeting, we lost him on 17th of May, which is 3 days later.
Okay.
On this day, we are doing a camp in his name, which is 17th May. We lost him in All India Institute of Medical Science, Dr. K.K. Agarwal, who started the CMAAO weekly international meetings. He said the show must go on. So we are doing a free vaccination, a blood test camp on 15th of May as a remembrance of what he has done for the society. That is happening in Delhi, and we are doing a lot of other camps similar way. It's just an announcement which I wanted to do on this session, because this session was closest for his heart. And I think this was, I used to talk to him and I used to tell him that, this is very important, roundtable think tank meetings. And he always used to say that, if this gets successful, we can in fact have information in advance and we do not need to rely on the media, on news channels, which might just inflate the things. We have associations coming up together, and if associations support us, it will be one of the very important things. So CMAAO was one of the very closest meetings, and when he got elected, he was very happy. So we lost him in the May. So I think these camps are very important, what we're doing for underprivileged people in India. So
thank you, Saurabh, for that update on the situation. And yes, it's been a year already, and it's been quite fast. The time has flown past, and we didn't really expect that it's been a year already. But certainly, thank you very much for the information about the camp. And we all have fond memories of Dr. Agarwal, in our hearts and in our minds. So thank you everyone for joining us again. And I look forward to next week's session as usual. And I hope to see you all soon. Thank you.
Thanks so much. Thank you so much for joining in.
Thanks, Saurabh, for hosting this all the way from Toronto. Thanks.
Yeah, and I think I would respect more for Monica, because it's midnight for her. I am actually yawning right now. It may be a jet lag or something, but it's very difficult to stand in the midnight and do these sessions. So hands off to people joining in from North America, and even from Europe, where it's very early morning. So I think it's a very important that we are doing this session, and I respect everyone, not only from people from Europe or America. I think I respect people, whoever is joining in and serving for the society. Even a 1% contribution is helping this. So I request these sessions to continue, and I think very, very important things happening. Thank you so much.
Thank you. Thank you, everyone.
You. Bye.
Thank you. Bye.
Thank you.
Bye.
Bye-bye.
Thank you.
ఓహో, ఈ బుగ్గల మీద మరక వదలడం లేదు.
శర్వరి, డ్రామాలొద్దు, సైన్స్ చూడు. మరక మీద సీరం ప్రభావం చూపుతుంది.
ఇది ఉంది కొత్త పాండ్స్ బ్రైట్ బ్యూటీ సీరం క్రీమ్ లో. 100% మరకను తగ్గిస్తుంది, స్పాట్లెస్ గ్లో తెస్తుంది. స్పాట్లెస్ గ్లో ఎక్స్పర్ట్ కొత్త పాండ్స్ బ్రైట్ బ్యూటీ సీరం.